when somebody gets the diagnosis of having any kind of cancer, it comes as a bit of a shock. It even came as a shock to me, uh, and I do this every day. So you need to make sure that the patient is having an adequate amount of time to process what they've just heard. They won't process anything you tell them after that. So it's very important to write down key points that you want them to remember and then expound on those points at, at another visit or at a different point in time so that you're not throwing a large amount of information at them at one time. Online, we have several sites that do help with the addressing patients' questions when we're not available, including the American Thyroid Association website, European Thyroid Association as well. I think that we have to understand that patients do learn about their diseases on social media and media as well, and they have access to a lot of information. And it's our job to help guide them to the most accurate places to find good information that's reliable. I think that having visibility about what tyrosine kinase inhibitors are, how they work, what are the side effects, in a very clear and concise manner would really help patients out and other clinicians who don't understand these new systemic therapies that we have available. There are side effects that the patients need to know about so that they can watch for them and let their other providers know that, hey, I am taking a TKI, and these are some of the side effects that I was told about. So we can have them be the best warrior in their journey.
We have a comprehensive cancer center here, which means that when we have patients, we have support for nutrition, we have support for transportation, we have social workers who will also get involved if there are some psychosocial stressors. We even have a program for people who have food insecurity where they'll even be able to go home not just with their systemic therapy but with a bag of groceries. So we really do a lot to support our patients in a really rounded way. I'll also say in cancer therapy in general, navigators are proving to be worth their weight in gold because with all of the different departments and people that we might be trying to access, having a single point person for that patient has been really making a difference in their being able to access that care, and then also being able to make the appointments and make sure that we can get them there safely and reliably. So navigators are also a very important part of our team. We'll want to be assessing what's their social setting, like who is in their family, who is in their home, who can support them when they come to their appointments. It sometimes can be overwhelming when I'm teaching somebody about a new therapy, and it's really helpful if they can bring somebody along to those appointments. So when we start getting past surveillance and we're starting to move in the direction of systemic therapy, that's a good time to say, hey, is there somebody you'd like to have join us in the conversation in the office so that we can do this together? The fact that patients have a often indolent period before they need systemic therapy offers us a unique opportunity to prepare our patients well for systemic therapy. Many of the therapies we're talking about are VEGF receptor inhibitors, and these cause decrease in blood flow. And the decrease in blood flow is good, of course, in fighting tumors, but it can also lead to some other things, one of which is loss of muscle mass. So all of my patients, I will be starting to encourage them from the moment I meet them to go and do strength training at a gym. Of course, if people have medical issues, we want to address those up front. If they have blood pressure that's not well controlled, we'll need to be working on that. We'll need to get that well controlled because another major side effect of the VEGF receptor inhibitors is it often raises blood pressure. We can also have patients who lose weight because they might have, diarrhea or something like that. So we want to make sure that they're, not losing weight before they go into therapy. We want to make sure they have good nutrition.